Aloha, I'm Keahi Tucker. Thank you so much for joining us for this Hawaii News Now presentation, Coronavirus Pandemic on the Front Line. For the next hour, we'll have a candid conversation with the men and women who are treating COVID-19 patients. We start with a special report from Allison Blair. She rode along with Honolulu Emergency Medical Services as they responded to 14 calls in a single shift. Nearly half were COVID-positive patients or patients believed to be infected with the virus.
North Quality Street for a sick person.
Copy, responding.
Sounds not good. District 2 is ground zero for COVID.
For Honolulu EMS, the coronavirus pandemic is like a marathon with no finish line.
In the past couple weeks, it's increased a lot.
It's both physical and mental exhaustion.
The moment a call's complete, the ambulance is dispatched to the next.
Sometimes it's just constantly drop off the next cleanup, you get bopped out again for another call.
For the crew assigned to Metro 1, downtime has become non-existent. 10 minutes after clocking in Tuesday, they were on the scene of their first call at the Equus, a Waikiki hotel turned government quarantine facility. The patient, COVID positive.
It's real. You're seeing this every day. It's the fever, the body aches, the weakness, the oxygen levels in their blood, it's very low.
Standing by in quarters, Metro 1.
Despite the latest lockdown, call volume hasn't slowed.
Did you call 911?
On top of its normal workload, Honolulu EMS has transported 307 COVID-positive patients to emergency rooms across Oahu since March, plus many more who were likely infected.
When did you get tested? No test.
Right there, we just never know.
And that critical information isn't always easy to get.
Do you speak Cantonese? I do have trust in the precautions that we take. We don't really have time to worry. Mask up, gown up.
Putting on all of those extra layers takes time. So does the new decontamination protocol. Prior to COVID, the average call would take between 30 to 45 minutes. Now it's well over an hour. And with hospitals in town operating at or near capacity, EMS can't always transport to the nearest facility. Instead, they go where the bed's available.
Hello, my name is Brent Shimabukuro. I'm a paramedic with the city. Are you related to?
Even if family wants the patient somewhere else.
Right now, they're just kind of sending us to a different hospital and dispatching us that way because of how busy it is. You're welcome. Okay, take care.
After the sun sets, the rush continues.
Not everyone's going to be deathly ill.
People are coming to us looking for answers.
9 hours into a 12-hour shift and no one's had a chance to eat. The only break was about 5 minutes, enough time to run to the restroom.
Even though you're tired and you're sweating and you're sore, I love what I do.
It's critical care for a community on the edge of crisis.
It's heartbreaking to see families, whole families being sick, and people saying that is fake. It's hard to tell the family that there's not much that we can do. They're isolated in an ER because they can't breathe.
In Honolulu, Allison Blair, Hawaii News Now.
Wow, great reporting, Allison. Thank you so much. And now let me introduce you to our panel. From Emergency Medical Services, Laura Kumamoto, Supervisor of Hawaii 1 Unit, Chrissy Miller, a registered nurse and the Employee Health Manager at Maui Memorial Medical Center, Dr. William Scruggs, Emergency Physician and Chief of Staff at Adventist Health Castle, Cortez Fabia, an Emergency Medicine Nurse at Straub Medical Center, and Captain Mike Jones, who heads up the medical response for the Honolulu Fire Department. Thank you all so much for being with us here today. I'm really interested to get your reaction first to Allison's piece. Laura Kumamoto, you first. A single shift must take a lot out of the crews. How are they doing?
We're hanging tough. I think for the most part we're we're trained in a culture that we're consistently adapting to any type of situation. But it has to be said that the additional PPEs and the decontamination, everything does take a bit longer just to make ourselves safer for our crew and safer for our next patients. But physically, the amount of PPE we're wearing and sweating and the additional decon time, there is very, very limited time in between calls. So when you have the COVID calls on top of our already large amount of calls that we had prior to the pandemic, people are getting a little worn down, to say the least.
And I'm guessing you need to stay mentally sharp every single hour of your shift.
You do. And, I think it's something that's actually inbred into us, that comes with the training, that comes with the desire to treat our patients with the highest level of care. So, mentally sharp, yes, we can do that, but it takes a lot more effort than it did before because physically we're just being worn down. And as you can imagine, living on this beautiful island, summer is here, and wearing layers of uniform and PPE, N95s, and full face shields in an uncontrolled environment at the beach, in a house. We sweat a lot, and dehydration is a real thing.
Yeah. Allison called it a marathon with no finish line. I imagine it's like that for firefighters as well. Captain Mike Jones, you folks often are the first ones at the scene. What are you finding, and how does the process work?
Yeah, definitely. I mean, a third of the calls that EMS goes to, you're going to see a fire company there first, just because of the proximity of the trucks and the number of personnel. And I think that this pandemic has exposed our personnel to a level of anxiety and stress that, might be surprising, but I don't think that we were prepared for. We're trained to respond to fires and auto accidents, but this invisible threat is something that our personnel are becoming accustomed to, but it's an added layer of stress that is definitely wearing them down.
And then after the patient is, you deal with the patient, next stop is the emergency room. Dr. Scruggs, what do you need to do when a patient arrives at the ER?
Certainly, our first priority is that evaluation of that patient, this is an airway and so forth, particularly with COVID. There's also concerns about safety of other patients in the department. And so we've all, in emergency departments across the state, created safe spaces for COVID patients, try to keep them separate from others, protect our staff. We mentioned the stress related to paramedics and fire. When they arrive, we have that same stress in our departments, and have an unending respect for those first responders out in the field and for our nurses and staff in the emergency department as well. It's a difficult situation. Everybody's doing a great job.
Mr. Fabi, you're in the ER. How bad is it for patients with COVID? What's it like for you to treat them and have to also provide them emotional support because their family, remember, cannot be inside the hospital?
Well, for the family members, it is often very difficult because they always want to be kept up to date as soon as possible with as much information as possible as what's going on with their family member. For us, the ER, it is very taxing. Having to gown up, gear up takes time. We have to make sure we bundle our care so we do not we limit our exposures of staff, our teammates, so we try to get in there, do everything at once, bundle our care, evaluate them, continue to monitor, and try to deal with the heat because wearing all that gear, I mean, you sweat, and I joke around and say I get sweaty Betty because I come out drenched like a sauna when we come out of those rooms.
Ms. Miller, similar experience for you on Maui?
Definitely, especially with our emergency department, we still have the tent outside. So our healthcare workers have to wear their personal protective equipment and they're outside, so it can be hot. So it's making sure that they're taking frequent breaks. And we know that that can be challenging sometimes, and staying hydrated. And definitely the impact of the workload is heavier, and so we're definitely seeing the same things across the board with the personal protective equipment being physically demanding on an individual.
What about the patients? They must be so afraid and they must have so many questions for you folks. Ms. Miller?
They definitely do have a lot of questions, but I think that our healthcare workers are doing a great job. They see that they're wearing the personal protective equipment. They're frequently wiping down spaces, and we want to encourage our patients. If you're having if you feel like you're having an emergency, we still want you to come down. I know they have a lot of questions and concerns, but they can definitely be confident that our staff have the adequate PPE, they have the adequate supplies to wipe down their surfaces. So we definitely want them to continue to come down and know that our healthcare workers have everything that they need to do their job safely and to take care of the patient safely, for sure.
Mr. Fabi, same thing for you. How is a COVID patient different than other patients with their questions and how you deal with them?
Well, because COVID's still such a fairly new thing here, when I do see the COVID positive patients, they often have the look of anxiety, stress in their eyes. They ask me, hey, am I going to be okay? And it often reminds me of the same question I got back in New York. So when I see these patients, especially when they're not that bad, and I just try to reassure them, hey man, let's keep taking Tylenol, let's rehydrate, you're gonna be okay, because I can see they're very worried and they're always concerned how this virus is going to affect them and the aftermath and what they can expect. And I don't always have the answer, but I can always tell them we're going to do our best to help them out.
Yeah, Dr. Scruggs, you must get the same questions, and I know a doctor's trained to be straightforward with their patients. What do you tell them?
First, people are smart and they've looked a lot of things up, and that's what impresses me most about this is how people are processing information. There's a lot of information out there. Most people come in with really good questions about treatment, about prognosis, and so forth. And like you said, we try to be as straightforward as we can with patients and comfort them, let them know they're going to receive the best possible care no matter what emergency department or hospital it's there at here in the state.
I'm guessing a few patients might also have some pretty wild ideas. Are you dealing with people trying to get you to do something you don't agree with?
I haven't seen a lot of that lately. I will say when this first started, the hydroxychloroquine issue came up several times with patients. But for the most part, people come in with just honest questions, and they're not coming with outlandish theories. They're not demanding certain types of treatments. So not recently.
Well, that's good to know. Our conversation is really just getting started. Up next, we're going to talk about what our panelists have learned about the virus through their own firsthand experience, how it impacts their professional and personal lives, and what messages they have for people who say coronavirus is just a hoax. As we go to the break, we spoke to people who shared their appreciation for everything our frontline workers are doing to keep us safe.
They're wonderful.
I can't just imagine, like how, what they're going through, but I appreciate their selflessness, I know it's part of their job, but they have their own lives too, their own families and stuff.
The world would be at a stop if it wasn't for them. And they're saving lives, they're putting themselves at risk, and they're my heroes.
Brought to you by Maui Health. We're here for you, our community, our hospitals. We are Maui Health.
Every day is an opportunity to save a life.
At Maui Health, our dedication to progressive technology and providing compassionate care to our patients is our #1 priority.
With award-winning cardiac and stroke care,
a world-class team of highly qualified physicians,
premier facilities, and the latest in technology.
From Kula
to Lanai City,
providing the best of care right here in Maui.
Our community, our hospital.
We are Maui Health.
When was the last time you inspected your home's roof? Let RNC Roofing Contractors inspect your roof for free. RNC Roofing Contractors is Hawaii's next generation of roofing experts with certified roof inspectors and experienced licensed installers. Choose from our large selection of roofing styles and materials from industry-leading manufacturers for a roof best suited for your house and budget. Give RNC Roofing Contractors a call today for your free roof inspection. 808-888-2524.
This pandemic has had a huge impact on all of us, but it's likely we haven't seen the worst of it yet. We know this disease preys on our kupuna and those most vulnerable in our community. In recent weeks, we've seen a huge increase of COVID cases in our Hawaiian community. As a lahui, we must be maka'ala, we must protect one another, and the time will come where we can return to our luau, our pa'ina, and our kanikapila. Till then, let's be safe and patient.
Due to COVID-19, everything was shut down. All of our events were canceled, starting from our Navy program to our hula festival and the graduation parties. I decided to apply for the financial assistance, especially since every dime mattered. During a time of social distancing, we need each other more than ever.
If you've been impacted by COVID-19, apply for assistance online at covidkokua.com or by calling 211.
Welcome back. We're talking with emergency crews about the coronavirus crisis. Let's focus on some of the lessons learned by our frontline workers. And we start with registered nurse Chrissy Miller from Maui Memorial Medical Center. So there have been 2 clusters involving staff at that hospital. How have you all adapted to keep the workers safe?
A lot of things that we've put in place is that we screen anybody that enters our hospital. We screen them for signs and symptoms of COVID. And we also have universal masking in place. And in addition, we offer our threshold to test our healthcare workers for COVID is very low. So if anybody is having any signs or symptoms of COVID, we test them here on site. We offer them return to work guidance. And we've also rolled out additional protective equipment such as face shields. And like I said, we have the universal masking in place as well.
And it seemed there was a learning curve when this all began. The hospital had to figure out how much PPE was necessary and exactly how to keep the workers safe as far as separating patients and testing. How quickly did that all happen? And do you have a deeper understanding for some of the challenges in trying to figure this out as a big public health perspective?
Yeah, that's a really good question. And some of the things that we learned throughout the first cluster was really the importance of just looking at everything from the break rooms to the personal protective equipment that we're providing, social distancing within the workplace. So it's just a constant thing that we have to adopt to. And then in addition, we have to remember that our healthcare workers are also part of the community. So what they do at home or in the workplace, we're just giving them a lot of guidance there. And those are the things that we've really focus on in the workplace.
I'm sure everyone is highly motivated not to catch this virus at work, but the hospital administration especially, they can't afford to be losing nurses right now.
That's right, and they're out. It is their top priority, definitely, to protect our healthcare workers, and so we're screening, like I said, everybody every day. We actually offer routine testing, and in addition, we're providing that return to work guidance. And we know that another challenge is that not everybody who has COVID will have symptoms. So that's why we really feel that this routine testing that we have in place will also help limit anybody coming in through our doors that has COVID as far as our healthcare workers are concerned.
Yeah, and that's a great point I want to take to Laura Kumamoto from Honolulu EMS, because the ambulance crews are having to face people every day who may seem totally fine, and I'm guessing you all assume every single person at this point might have it.
We do. In the beginning, it was a little bit easier to try and determine who had COVID, who didn't, because the numbers were so low. We took the precautions. There were screenings done by our dispatchers, but pretty much now, you have to assume every single person has COVID. I can recall my very first COVID call where the husband was sick, ill, needed treatment and transport, and the wife was adamant that she wasn't ill. Well, unfortunately, 2 days later, she called the ambulance back because she couldn't breathe. And it just goes to show how it's a super spreader, and how people, not knowing that they have the virus, will not show any symptoms until 2-4 days later, and by that time they could have potentially infected numerous other people.
What are you learning about how the virus affects different people differently?
Well, for myself, I think you'll pretty much see the virus affect people physically in the same way potentially a lot of other viruses do. There's a lot of the respiratory component in there. It's the fever, the chills, the shortness of breath. In the beginning, not as many people needed treatment and hospitalization. Now we're finding that it's not just the number of known COVID or suspected COVID cases that we're going to, it's the number of patients that actually need treatment and actually need hospitalization. We went to a house the other day where there were 8 people in the household. English was their second language. 6 of them were tested positive for COVID, and unfortunately 4 out of that 6 were hospitalized. And unfortunately, because they had a language barrier, they also didn't know how to tackle the virus from the very beginning with the first positive patient within their family.
And you're doing all of this while wearing a huge amount of that protective gear. It must be so difficult.
It is, and physically, it is quite challenging. You know, in my 26 years within this department, I have never worn PPE and decontaminated our surfaces and ambulance to this extent. But we are fortunate that we do have the PPE that we do have to make sure that we are safe, our patients are safe, and our families that we go home to are safe.
And are there certain parts of Oahu, when you get called there, you almost are sure this is going to be a COVID case? Are there hot spots still?
There are hot spots. We do know certain areas where, the state or people who are known positive, where they have no place to isolate at home, that they are staying in certain hotels or establishments. But it's everywhere. It's not just certain clusters. You can go to just one household, and one day you have one positive patient, but that one person may live in a household multi-generations of 10 people. And then you end up going back the following week or a few days later, and it just grows and grows. So I haven't seen any one particular hotspot because it's just so widespread.
Yeah, and we're all so connected. Dr. Scruggs, can you talk about the variety of the symptoms you're seeing in the ER?
There's such a huge spectrum, anywhere from asymptomatic folks who come in to be tested because they've had a contact with somebody who's been positive, all the way up to somebody who's just really sick. It is interesting to me, the classic pattern kind of the patient who does come to the emergency room who ends up being admitted. They may come in for a variety of symptoms. One example, I had a patient last week who came in complaining of diarrhea. And you start hooking them up, and it didn't look that bad, but we put him on the pulse oximeter to measure his oxygen level, and it came back about 80%. And that's very low. Most people are above 94, 95% at baseline. And he was talking to us, said he didn't really feel short of breath, maybe a little bit when he was up and ambulating. But in my experience with this virus, once they hit that point where they're going to be hospitalized, you're just looking for that pulse oximetry number. They're a little bit dyspneic, short of breath, maybe breathing a little bit quickly, and their pulse oximetry level is way lower than we would ever expect it to be in the average person or a normal patient that we see with another disease process.
And then once someone is admitted, how challenging is it to kind of get over that hump and actually start getting better?
It's very person dependent. So this virus can cause long-term illness. We have learned quite a bit regarding treatment over the last several months in terms of managing their airway. When we first started working with patients, as soon as they came in with that low oxygen level, the paradigm was to intubate immediately to try to prevent spread. We thought we were doing good for them by increasing their oxygen levels. And we've learned now that that's probably not the case. We need to try everything we can to try not to put a breathing tube down, because that may make people worse. We have prone positioning, try to flip people over to improve their oxygen levels. We find once we get that breathing tube in, they can be really tough to get off of the ventilator. So we do have some treatments now with Decadron and Remdesivir, trying to get them stabilized and on the road to recovery. And then unfortunately, that road to recovery really can be long-term now. We see patients 3, 4, 5 months later still having symptoms, maybe being short of breath, fatigued, having a difficult time walking around, some neurologic symptoms that can persist. We really don't know the extent in terms of the duration and full recovery and what that really means to everybody.
Yeah, we'll talk a little bit more about that in this hour. Thank you so much. Coming up tonight, responding to the surge in hospitalizations, the impact on the staff and frontline workers coping with the fear of bringing the virus home to their families next. As we go to the break, we want to say mahalo to another group of people very deserving of our appreciation, the cleaning crews at the Queens Medical Centers in town and West Oahu and all the rest of Hawaii. They're working hard to keep facilities safe, and they're playing a crucial role in the response to the pandemic. Thank you, everybody out there. We'll be right back.
Sponsored by the Queens Health System's family of hospitals and clinics. Our doctors, nurses, and other caregivers can ensure you safely receive the care you need.
When you need power like this, you need Yamaha generators. For over 40 years, the same toughness, quality, and performance you've come to expect from Yamaha motor products in world-class portable power. Whether on the track, job site, or at home, depend on Yamaha's world-class portable power. A reliable power source anywhere, anytime. It's efficient, easy to use, and it's quiet. Yamaha generators. Nothing can compare. Yamaha generators at Waipahu Lawn Equipment.
To address high COVID-19 infection rates, Honolulu has returned to lockdown rules. It's a proven way to control the virus. And keeping our social gatherings smaller is extremely important. 5 or fewer people. If we all act now, we can reduce the numbers of people getting sick. So the best way to become closer again is by staying apart. For now. Work from home, wear your mask, keep your distance, 5 or fewer. Common sense ways you can protect yourself, each other, Hawaii.
When choosing a college, where do you belong? You belong at a school where people and professors know your name. At a world-class university that feels like home. At a college that's also a tight-knit community. At a place that will push you to find your purpose. Belong to something bigger. You belong at Chaminade. Apply at chaminade.edu.
Define your space with the new vinyl deck, railing, and shade select adjustable pergola from Best Vinyl. Adjustable pergolas are all season, providing shade when you want it and direct natural sunlight when you want to warm up your space. And our vinyl rails and decks will outlast wood, cleans easily with your garden hose, and will withstand years of use. So, whether it's a residential or commercial area you want to enhance, call Best Vinyl and define your space.
Next week, Jeopardy returns, and the GOAT joins the Jeopardy team.
Don't worry, I'll still be the host.
Next week at 4:30 on KGMB.
I'm trying to find like some light at the end of the tunnel, and I can't seem to see it.
Ever since COVID happened, I've never really been able to see like the bright side of things.
I don't know when I'll be able to see my sons again and their families.
Sometimes hard, especially us old folks. It's hard.
And I'm worrying that I'm going to be able to afford to buy food because some of the food prices here are so high. And worrying about paying my rent each month.
I miss like playing with my friends. School lunch was the best.
This is the pits.
Boy, it really is. The past year's been so rough on everyone. And that goes, of course, for our frontline workers. So we're talking tonight with our panel of experts all about that. Let me introduce everyone again. Laura Kumamoto, supervisor of Paua 1 unit from Honolulu Emergency Medical Services. From Maui Memorial Medical Center, registered nurse Chrissy Miller. She's also the employee health manager there. Dr. William Scruggs, an emergency physician and chief of staff at Adventist Health Castle. Cortez Fabia, emergency medicine nurse at Straub Medical Center. and Captain Mike Jones, in charge of medical response for the Honolulu Fire Department. Once again, thank you all so much for being with us. Mr. Fabia, can you tell us about the toll this pandemic is taking on nurses on both a professional and a personal level?
The toll is just very, very demanding.